We are in the peak of respiratory illness season, and children, they can be hit by these viruses really hard. So we've got one of the pros in our studio now to talk more about prevention methods should your child get sick. Dr. Robin Boyer is here. Thank you so much for stopping by.
Thank you for having me.
And we were talking about the different triggers that can cause these flare-ups, if you will, and the season's changing is one of them.
Yes, absolutely. So every November through March is respiratory viral season. So that is when we have our tons and tons of different viruses come out, and be on the lookout for every year the same symptoms for our children.
So we're talking about the flu, the cold, and what else?
So we have the flu, known as influenza virus. We have RSV, which is respiratory syncytial virus. We have rhinovirus, which is the common cold. We also have other viruses as well that come around, as well as different pneumonias, which can be viral or bacterial.
So when should you as a parent be really concerned? Because for your pediatrics, that's your specialty, so we're going to focus on the little ones today. When should you be concerned when that congestion just isn't going away?
Absolutely. So things to look out for specifically are any increased work of breathing. And by that, I mean when we see our kids have that really bad tummy breathing and using their ribs and all of their muscles in their chest. Things like nasal flaring, you see their nose kind of flaring in and out. That means that they're having a little bit of difficulty breathing, and they should really be evaluated either urgently by their primary care doctor, their pediatrician, at an urgent care or an emergency room. So those things, as well as if there is a fever that lasts for more than 5 days in a row. And we consider fever anything above 100.4, 100.4 or higher.
Okay. And in terms of recovery, you know, some of these viruses, they have to run their course. There are over-the-counter medications that can help, but that's only for the symptoms?
Yes. So with viruses, it is something that unfortunately just has to run its course, as you mentioned. However, again, we look for any fever that lasts longer than 5 days in a row, because that means that the patient might actually have a bacterial infection that needs antibiotics, and that will require prescription from a provider. Additionally, the other things that will help is if there's continued vomiting or diarrhea, it is important to encourage fluids, and if the patient's unable to keep them down, they also need to be seen for IV fluids.
And I know specifically you're at Thomas Hospital, which has a great pediatric unit.
Yes, yes. So we have a 12-bed pediatric unit there, and we have 3 staffed pediatricians, such as myself, that are available 24/7, 365 days a week, or 365 days, available for any patient that needs to be admitted and needs further care. So we are there for all of these respiratory viruses in this season in case any patient needs antibiotics, oxygen, continued treatment, or IV fluids.
Yeah. Now, I know prevention is the best way, right? No one wants to get sick. I'm curious how doctors manage to stay so healthy, because you guys are there all the time.
Absolutely. So the way that we do is hand washing, hand washing, hand washing.
Okay.
We also, in case you're unable to hand wash, lots of hand sanitizer in between until you're able to. If you are around those who are sick, cover your mouth, use a mask if able to. The other thing is we all get our flu and COVID and RSV, for those who are eligible, vaccines. So those have been, they don't necessarily prevent you from getting sick, but they do shorten the course of the illness and prevent the severe symptoms.
Well, thank you, doctor, for stopping by.
Absolutely. Thank you for having me.